If anybody else wants to make additional remarks, Senator Sanders.
Thank you, Madam Chair. And it's not quite urgent, but I did briefly want to respond to some of the remarks of my colleagues. In terms of health care, we have a simple issue. Is health care a human right in which all people, regardless of income, are entitled, or is it not? It's a fundamental question. I happen to believe that it's a human right. Is there something wrong, my friends, when the United States is the only major country on earth not to guarantee health care to every man, woman, and child? Yeah. I think we are the odd guys out. I think the other countries are right in saying that all people are entitled to health care. And in the midst of all of that, is there something maybe wrong when you got 90 million people in this country who are uninsured or underinsured with high copayments, unaffordable premiums, etc., and yet we end up spending by almost twice as much what other countries on earth are spending? I live 50 miles away from the Canadian border, and somehow or another they do manage to provide quality health care to all of their people, spending approximately 50% per capita of what we're spending. And you got the pharmaceutical industry. I don't know if we have any lobbyists here because they're all over Washington right now. You got 1,500 lobbyists of the pharmaceutical industry. They spent $300 million trying to defeat our ability to finally negotiate prescription drug prices with Medicare. $300 million in lobbying alone. That's called a broken system. So I say to my Republican friends, you tell your constituents why in some cases we are paying 10 times more for the same drug as people in other countries. Yeah, the system is broken, but the answer is not to give more power to the pharmaceutical industry or the insurance industry. The answer finally is to guarantee health care to all people as a human right.
Thank you,
Madam Chairman, I feel a need to respond to that.
Okay, and
I'm not going to give a long response, just this, which is there are a lot of things in the pharmaceutical industry that I think are terrible. I'm sure things